Assalamu alaikum and welcome to yet another episode of the Did You Know show. Did you know that the United States government has been proud to partner with the government of Pakistan to help stem the tide of the COVID-19 pandemic? Pakistan health officials work with USAID to implement COVID-19 response activities in targeted areas, including training for health workers, providing medical supplies to health facilities, leveraging existing technology to help track and monitor COVID-19 cases, and countering disinformation campaigns so people have the necessary information to protect their health. In addition, the United States contributed 200 ventilators in July this year, which were distributed to 64 hospitals in 46 cities across Pakistan. These ventilators will help those in critical need throughout the country. So, health sector is our new topic for this week's show. Let me introduce guest joined Mr. Khalid Mahmood, supply chain advisor from USAID. We also have with us Country Director Chemonics International, Dr. Tariq Mahmood. And then we have Dr. Ali Khashan Malik from Aman Foundation, Karachi. So welcome to our show. And let's start our questions with Khalid Mahmood Saab. Khalid Saab, the United States contributed 200 ventilators in July this year. Would you like to share the details and tell us more about USAID's partnership with various stakeholders?
We have been supporting a lot of good work and activities in Pakistan, which are well positioned to not only support other work that we are doing, but also it formed as a basis to support COVID in Pakistan. When the first COVID case came in February this year, we had already established a logistics management information system for infectious diseases and other supply chains. So we were so well positioned that within 48 hours, we started capturing the data around COVID, and government started to work with the development partners to initiate activities to procure needed commodities for COVID response. So that was a moment when the critical patients were increasing in country, and Prime Minister Imran Khan requested the US government to donate any ventilators. And thanks to the US government, President Trump donated 200 ventilators immediately. And from that point onward, in March, we started working with the Federal Health Ministry, Pakistan's National Disaster Management Authority, NIH, CDC, and other stakeholders, including provincial governments, to position ourselves and look at the facilities and hospitals that needed those ventilators because of the COVID patients' load and the needs for the critical care. Moving forward, we went ahead and contracted 4 vendors, local 4 vendors, who did all the excellent work in distributing, doing the facility assessment, training, commissioning, all the ventilators in 64 sites. So I'm glad that we are almost at the end of that activity where the distribution is complete, health facility assessments is complete, the commissioning and installation is complete. The last piece is the training that is ongoing, and hopefully by end of September, that will also conclude. So you will appreciate the fact that this ventilator support is creating lots of impact in the country by not only adding 30% capacity of the country's diagnostic as well as critical care by adding these ventilators. It increased 30% of the capacity for critical care response. In addition, with these ventilators, more than 6,000 people are saved every year. And moving forward, that's how they are going to be utilized. So this is huge impact. And in addition to that, there are 570 people who are being trained on the use of ventilators. So it will be a very well professional trained staff at each facility that have received these ventilators. So there won't be any issues in using the ventilators. So they will be very well ready and prepared.
Thank you so much. So in addition to the ventilators, what further efforts have been made in terms of health systems?
COVID is just one piece of the support that U.S. government has started supporting right now. It's a decades work in the past, starting from 2010 in the supply chain, where we have been strengthening the supply chains for family planning, for vaccination, immunization, TB, and now our work pivots to address infectious diseases, which is one of the agenda under the global health security agenda, so that any pandemics or outbreaks, not only they are surveyed and predicted earlier on, but also the government and the system is ready to uh, respond to it immediately. The entire health team at USAID is engaged through different activities, working at the health facility level, at the community level. So we are all making efforts to do different pieces of the good work that supports and strengthens the overall health system in the country. In a sense, we are creating a journey to self-reliance where government itself is capable to do all those technical work that otherwise donors or other international NGOs support.
Dr. Tariq, would you like to tell us about the process you and your team used to receive the equipment and also ensure it got to the health facilities that needed it?
Thank you so much, Sheila. I think it has been a tremendous experience. The first thing was, the placement of the order, making sure, that 200 ventilators, that was a commitment from US government to Pakistan, were actually procured, and then moving them into, the aeroplanes and, custom clearance and, getting them at different airports in, Pakistan, mainly Karachi and Islamabad. So that was basically the international part which happened. But as soon as we received it in Islamabad and Karachi, we actually got those to, it was a whole plan that we made with TCS Pakistan and, of course, two more partners who were actually also engaged on the health facilities assessment and also the training part of the ventilators actually. So by the time we received, it was a great collaboration with the National Disaster Management Authority. Colleagues at the National NDMA were very closely coordinating as to how we make sure that the equipment actually reaches to places and health facilities, isolation centers and wards and ICUs where it is needed the most actually. So this exercise was basically started before actually the equipment, ventilators arrived in Pakistan, and NDMA and ourselves, we were coordinating with the provincial governments to identify the right facilities. And then there was a prioritization within health departments. So all those facilities that you kindly mentioned, 64 facilities in 46, cities of Pakistan were identified. And by the time we received this, consignment, the relationship between US government and Pakistan as to make sure that the work remains seamless and the equipment, is picked up at right facilities and it goes within the shortest possible time, because this was a time when, ventilators were not available and the government of Pakistan needed them most, actually, as you rightly said. So we then engaged another agent, which is basically the manufacturer agent via ventilators. So ventilators were manufactured in, USA. So their agent was, hired in Pakistan to make sure that we extend state-of-the-art biomedical training. Conventional training on ventilators is very much available when you say, basic life support or advanced life support or ICU support. It's a very clinical-oriented training that you can find anywhere, but you don't find really sophisticated equipment biomedical training actually. How to start a ventilator, for example. How to attach circuits for oxygen supply, for example. So we have been engaging anesthesiologists, pulmonary chest specialists, ICU technicians, ICU nurses, medical doctors, and the respiratory, therapist, and all those people who have been actually part of this, understanding that how this 30% increment in Pakistan's biomedical critical care capacity is going to be translating into those 550 champions who will be actually right on top of using this state-of-the-art equipment. So Artima was engaged, and they had this training tailored to the requirements of our own Pakistani bilingual settings, Urdu and English both, and in clinical and layman language. We had those trainings, and more than 550 people will be trained across the country. And so far, we have trained more than 519, actually. So this has been a tremendous experience, Sheila.
I would like to ask, although the ventilators are all delivered, your work on the COVID-19 response continues. So what other activities are involved in regarding working with the government of Pakistan and USAID?
Yeah, no, I think it has been honestly. I mean, I feel very privileged to be associated as a bridge between U.S. government as a U.S. government contractor and the government of Pakistan to serve those kind of bridging support for supply chain management and health systems strengthening. I see the partnership with NDMA has been critical. National Disaster Management Authority has been playing, the most important role in not only translating the U.S. government support, but also making sure that other elements of World Bank and Asian Development Bank is also translated. So NDMA was a central body in terms of taking these 200 ventilators right to the last mile where it was needed.
We are also very much privileged to have with us Dr. Ali Khashan Malik, who is from Aman Foundation, to tell us about yourself and how did you get into the healthcare field.
First of all, I would like to thank you and your team to arrange such a nice platform. Basically, I'm working with Aman Foundation since 2009 and currently working as Deputy General Manager of SRMS. SRMS means Sindh Rescue and Medical Services. Basically, we are previously we are called our services as Emergency Medical Services. I'm working here since 2009, working from the post of Emergency Medical Officer, and right now working as Deputy General Manager Operations. When I was in grade 8, then I saw an accident, and at that moment, I haven't any idea to deal with the patient, deal with the victims of RTA at that moment. That's the point of time when I decided to become a doctor, become a physician, to serve the needy people, serve the victims of like RTA. I was at the front when the RTA was happened, but I didn't do anything because I have no knowledge for stopping of bleeding or for managing of trauma. My experience of pre-hospital emergency care is very much clear from my previous study. Like I have done my MBBS from Dow Medical College, and then then I was a junior research officer in molecular medicine. But when Aman Foundation started in 2009, I was joined Aman Foundation for the sake of serving humanity in the Karachi, for the community of the Karachi.
Okay, thank you so much. So if I may ask you, particularly about the ventilators training, how useful has the training been for you?
Really a very much fruitful and very much useful training for us, because we have the respiratory devices, we call it VR1. We are in need of ventilator to transport, vent-supported patient from hospital to hospital, or if call came from home, then we are also in need of ventilator to provide our support to the patient if he need ventilator or vent support.
Thank you so much. You have been doing a wonderful job, and I'm sure you are there for the people at large, at service always. So thank you so much for joining with us. And with this, we come to the end of our show. And next week, we will join you yet again with another episode of Did You Know Show. Until then, Allah Hafiz.